Now to some movement. Who's ready to move? We have Elizabeth Bohorfoush. Am I saying her last? Bohorfoush. She's a physical therapist at UAB. We're very excited to have her talk to you guys. She's very passionate about helping people with cancer and exercise and physical debility that comes alongside. And so I'm very excited to hear what she has to say. There are some handouts that are going to be passed around. I think we're going to learn to floss together tonight or something like that. So please give a round of applause to her.
Hey, y'all. I know I'm the last one, and everybody wants to get out of here. But I wanted to just bring something to you today. It's movement is medicine. Thank you. You told me, you just like pushed it out there for me. And with my patients, that's the biggest thing, is just teaching them that moving and being active is so important when you're in chronic disease and as a caregiver. That's a huge part of what I do in treating patients. Question, how have you moved today? All these different ways. Maybe you just like walked here from the Hilton. It all counts. That's the biggest thing here, guys. Grace. You got to give yourself some grace. We don't have to go to the gym and do a HIIT workout to feel like we've done some exercise, right? You can say, I'm going to get up and I'm going to go walk around down the hallway back and forth twice. It's about all I've got. But what I want you to have is successes. You've got to have some success. If you have a failure, if you're always making these like big goals of like what you want to do, I'm going to get out and I'm going to go to the gym and I'm going to do a 30-minute workout. And then you can hardly like get your clothes on and then you're exhausted. Then you have a failure and then you're like, I'm not going to do this tomorrow. This is exhausting. I don't want to even try. But we want to make things real easy, little snack bites and small, so that you want to get up and you want to do it tomorrow because you've had a success with something that you've done. And look at this. This is the Academy, the ACSM, the Academy of Sports Medicine. There's a whole gamut of exercise from the HIIT workouts to just walking or parking a little bit further. That's a big one, guys. Park at the end of the parking lot and just walk to Target. That gets you get your steps in. Physical and psychological side effects of chronic disease on patients and caregivers. We have lots of things. Fatigue also in this. We're dealing with so many things emotionally and physically, and a lot of times our pain and our anxiety and our stress has this huge emotional component, which, like Richard was saying, emphasizes and inflames the pain and the anxiety and the fatigue that we're feeling. Today, what we're going to work on, the fear of new pain or issues. I have so many patients who come to me and they're like, I've got a pain. Something's back. It's and you spiral. The spiral that happens where you've had this problem, and then they come to me, and I'm like, hey, no. Let's work through this. This is really what this is. And so this is just another little thing. I wanted to show you guys real quick benefits of physical activity for cancer and caregivers. This is not just cancer patients. This is caregivers, guys. It helps to reduce so many different things. Look at it. It's really fun. But the one thing that I really wanted to do today is it buzzes. Okay, there we go. We're going to get moving. All right. Sorry. I'm trying to okay, so we're going to get moving today. And I want to give you guys it's just 4 exercises, okay? But what these are these are exercises that so many times I have patients who come to me who have pains or issues that they're having, and these little bitty stretches can help. Also, if you are having a lot of fatigue or you're just having a day where I cannot do anything, these are some simple little things that can get you started to get moving, to get a little success that's happening. But the first one we're going to start with, the first thing we're going to start with, and everybody actually is doing this with me, All right, we're gonna do a shoulder blade squeeze, all right? So you're gonna put your palms up, all right? We're getting moving here, guys. And we're pulling our hands back like this, and we're squeezing our shoulder blades and kind of pushing our elbows down. What do we do all day? Everybody sits like this forward head, rounded shoulders position. We hurry up and wait to new appointments, and then we sit in a chair. We look at our phones. We work, all of our working is in this position. Y'all can relax, do it like hold it for like 5 or 10 seconds, and then relax. You don't have to keep doing it. But every time that you have that pain between your shoulder blades, that's what you want to do. I saw this gentleman in green. You were rubbing your shoulder just a minute ago. I saw you rubbing on your shoulder. And this helps. So what we're doing is we're increasing the blood flow to this area, to the back, okay? The shoulder blades. It also, we have internal rotation right here of our shoulders, which then, if you then try and reach up at something, you're going to get biceps tendonitis right here a lot of times, where you get that pain right here when you lift your arm up. Or you can get this pain behind the shoulder blade, behind the shoulder. It can start stretching out that rotator cuff. So you get some pains right there. Or, and so we're stretching our subscapularis, which is this muscle in the armpit. So we're doing the opposite of this position is this, right? All throughout the day, when you're sitting at the hospital or you're sitting, whatever you're doing, just squeeze your shoulder blades. You're sitting at your computer. That's a great way to kind of work through that. All right, this one. Just your hand weight. Don't like pull your head off. But what we're doing, again, this head posture, forward head, rounded shoulders. What we're doing is we're going to tuck our chin, and then we're just pulling our head down. And then you can pull to the right side, and you can pull to the left side. Now, if you get neck pains from your muscles being tight right here, this is an amazing exercise. If you get migraines right here in the front of your head, it's because the muscles right here get tight. They're the suboccipital muscles. They create a headache and you get a migraine right here. So this is the best way to kind of, stretch through this and work through that area every day, holding it for like 10 seconds or something like that. A great exercise to work through. The next thing, this is a big one. A lot of times you guys we sit all day, okay? And when you sit, your hamstrings get tight, your calves get tight, and your hip flexors get tight. So and not to mention a lot of times you guys might have, oh my gosh, I'm having bone pain, more bone pains coming back. Sometimes it's just hamstring tightness or calf tightness here. So you can either put your leg up on another chair if you're sitting next to an empty chair, or you're going to put your leg out. I need to see you guys doing this. And then you're going to put your toes up to the sky, and we're not leaning forward with our head. We're leaning forward with our chest, okay? Because that will stretch out that hamstring a little bit more. Good job. But you're leaning forward just a little bit. You can also do it with your leg up, like if you're on your bed or on your couch. You're going to put your leg up, and you're going to lean forward with your chest, and that takes out your back. Because I can stretch all day if I'm just doing it with my back, but if I take out my back, it's a lot looser. If you have low back pain across your low back, it might be your hamstrings. And if you get that no butt disease, there's a lot of men that have the no butt disease, and that is from, sorry, am I allowed to say that? That is from tight hamstrings, okay? You might have tight hamstrings if that's what you have. But a lot of times it's from our sedentary lifestyle. And because what happens a lot of times, we go from a very active lifestyle to we're sitting a lot more. Okay, the last thing we're going to do is a hip flexor stretch. Now your hip flexors are kind of like a pork tenderloin. They kind of look like a pork tenderloin, and they go from L3, L4, L5, and they come around, there's two of them, and they attach right here, okay? They do this, and they do this. So when you go down and you pick something up and you're like, oh, that's your hip flexor, okay? You've hurt your hip flexors. If you have SI joint pain, where that pinchy pain, or that toothache in your butt cheek, the piriformis pain, is what I'm sorry, I have all of these like things that all of my patients tell me it's what it feels like, but that pain, that gnawing pain in your butt cheek that will not go away, that's going to be your piriformis, okay? And the reason why the piriformis is tight is because your hip flexors are tight. So we're going to stretch those, so y'all stand up with me. We'll stretch our hip flexors. The way we're going to do that, to be safe, you can do it between a table and a chair, or if you're able to just stand here like this. And the key is we're going to tuck our pelvis under, and we're going to squeeze the butt cheek of the back leg. I'm sorry, is that super inappropriate to say? Okay. You should feel the hip, you should feel the stretch right in the front muscle, right here of the back leg. Do you feel it? Yeah. All right, now do the other side. Now switch sides. So switch legs. So you're going to put one leg forward, one leg back. Tuck your pelvis under. Woo! Kind of like you're going to tuck. You remember like the Batman and Robin, where the old school where they go kapowie, and they like do like that, you know, kapowie, boom. That's what we're doing. We're tucking that pelvis under, okay? And we're going to squeeze the back butt cheek, and you should feel the stretch through here. That is your hip flexor. If you'll keep those guys loosened, then you'll be able, it'll help with that SI joint pain, that piriformis pain, or the hip flexors through here. And it'll help you have really great, it'll help with your back health overall. So those are 4 little nuggets for caregivers and for patients, so that if you're having, what I wanted to do was just give you some little tools to put in your toolbox, so that if you do have any of pains like that I kind of described today, you don't go, you have some authority. You have something that you can pull out, some exercises that you can be like, all right, let me try this before I go over to here where I'm spiraling and it's something else that's new. Because that empowerment of understanding what's going on with our bodies helps us it helps our well-being, and it helps us to feel a lot better and to sleep at night and to work through the anxiety. So I hope that helps you. Thank you. All right.
Thank you so much. I think this is the most exercise I've had this year. So I think now I know how to tilt my pelvis the right way. No, this